Welcome to this video. Today we talk about health and hygiene, standard 7 science, health and hygiene. So what is health, what is hygiene? Health is a body that is functioning normally. Hygiene is keeping the body speck and clean. So what is health? Health is absence of disease. So disease means what? Not being at ease. So it can be physical, it can be mental. Mental means what? Of the mind or of the emotions or of the psychology. Physical is for the body. So when you are not at ease, when you are not comfortable, when you are feeling a discomfort, when you are distressed, then it means you are having some disease in the body or mind. So not being at ease is disease. So it could be ailments, some sort of sickness you are having. So the sickness that you are having or the disease that you are having could be a communicable disease, could be a non-communicable disease. Communicable disease means from one person to another it will spread. Non-communicable means it will not spread from one person to another. So if there is a disease, then what are the potential possibilities? One is you can prevent. How do you prevent? By good habits, by being clean and keeping yourself safe and away from the disease causing situation. That is cleanliness. Being clean not only means washing your hands, it also means keeping yourself, body and mind, away from disease causing situations. You have to take care. What do you take care? If you did some prevention but still you fall sick, then you have to do a remedy. What is the remedy? Remedy is to rectify. How do you rectify? Maybe you will take some injections, take some medicines and things like that. Now it is possible there are some diseases which are not curable also, right? Not all diseases can be cured. We do not have medicine today for a lot many ills that human beings are suffering from. Now what is a cause? Now, when somebody is sick, there can be hundreds of types of sickness. The sickness can present itself in different symptoms. What it appears to you, to the eyes, ears, and nose of the person who is looking at you. Well, how do we observe? We observe through our five senses: what we see, what we hear, what we smell. So, this is how we observe something, right? So, when a person is looking at another sick person, he may form his own opinion in his mind as to how sick a person is, why he is sick, what he would have done, what he should do. So everybody will have their own idea. It could be because of the literacy or illiteracy. A doctor may think something. Again, a surgeon or a physician will think differently. Again, a heart surgeon or a cancer specialist or a kidney specialist will have a different view about a sickness than a normal person. So literacy or illiteracy will have an effect. Likewise, ignorance. Now, if you are just 1 minute before only you saw the sick person, if you don't have any idea about the background, any idea about the person, any idea about the situation, any idea about the environment, if you don't have any information, then that ignorance will give you room for creating or believing certain opinions. So that is one reason why you will have a different point of view about a sickness. One is superstition. Superstition is beliefs which might have no scientific basis, beliefs which are pegged or tagged to good old ancient traditions and rituals which may not have relevance or significance today. And some could be belief. Belief can be any number of types of beliefs, including religious beliefs, right? So certain races, certain castes, certain people of different ethnicity have different beliefs about the reasons or the causes or the remedies for different illness. That has come traditionally because of some historical reasons. From time immemorial, people have been believing like that. So if you have a fever, a person in the tribal village of Africa will have a certain approach towards it, while a person in the tribal village of India will have a certain different approach, while a person in the American tribal nations, the Inuit nations, they will have a different idea about why somebody is sick. Even today, in lots of tribes, we have people called medicine man or a treatment woman. Why? Because of their beliefs, because of their knowledge about certain things, because of their understanding of certain ways and nature behaves, they are able to approach a particular illness in a particular fashion. Okay. Now, we all know health is wealth because from KG1, KG2 onwards, everybody has been telling us health is wealth. Why health is wealth? Even if you have all the wealth on the world, you will not be able to eat a proper food if you don't have teeth. If you don't have tongue, you will not be able to taste your food. If you are sick, because of the higher temperature in the body, your tongue will not recognize any taste. So whatever best food is given to you, it's of no use. That is why we say health is wealth. Actual money is not the wealth, health is wealth. Because if you are healthy only, you will be able to reasonably live up to 60, 70, 80, 90 years of age. Or else what will happen? Your life will not be meaningful if you are ill and sick all the time. So how to be healthy or why health is wealth? Because if you are not comfortable in your body or in your mind, then whatever you do will not be satisfying. If you are not comfortable with your body or mind, if you are having some disease in your body or mind, your activities will not be effective, you will not be efficient, you will not get happiness by whatever you do. So for that, what is the first thing that you need is general hygiene. General hygiene means what? Overall, you should keep yourself clean, your surroundings clean. You should try to breathe clean air. You should try to drink clean water. You should walk on clean soil or clean places. So you should have practices that promote good health. That is good hygiene. The habits that prevent ailments is good hygiene. So good hygiene is nothing but practices and habits or rituals that help you ensure you don't get sick, that help you ensure your health becomes better and not worse. One of the things that you need to do for this is you should have nutritious meals. You should not have junk food 3 times a day, 7 days a week, 365 days a year. So you should have nutritious meals. When you should have at the right time, 3 meals a day, 2 meals a day, whatever your habits are, regular habit at regular time at the right quantity. You cannot have one full large pizza in the morning and then not have anything for 3 days. So you should have right quantity and in right frequency. You cannot have food every 1 hour or once in a week. You should have it in the right frequency, right quantity, and it should be nutritious. Then you should also have adequate exercise. If you just keep on eating only junk food and do nothing, then it will tell on your body's health. You should have a good rest and you should have a good sleep. Good sleep is one of the best ways to help the body recover whatever it lost during the day. Many of the common simple diseases are airborne or waterborne. That is why BORNE borne means carried by. That is why we say hygiene and cleanliness is important. That means what? We have to wash ourselves, we have to wash our hands, we have to wash our mouth after having food, we have to wash the fruits and vegetables and rice and grains before we cook. After the vessels should be well washed before we cook. After we cook, the plate should be well washed before we eat. We should keep the food closed. All these things is necessary to prevent airborne or waterborne disease contamination. So we saw cleanliness is important. What is cleanliness? Cleanliness of the environment. How? Proper disposal of sewage, whether it is industrial, whether it is domestic. Whatever sewer is there, we should have a proper disposal. If there is a drain, it should be covered. There should be a proper outlet for the wastewater to go. It should not be a breeding place for insects or germs and worms. And then if there is a possibility of a land, water or air pollution, we should prevent and contain. So only treated water should be let out. Surroundings should be clean. Community should ensure the whole society is clean. Else, what will happen? For example, if there is a stagnated water, it will give rise to breeding of mosquitoes, which will spread malaria. So that is why we should keep the surroundings clean. We should segregate the waste and dispose properly. If you if there is a product which has mercury, if you just throw it away, mercury is poisonous, so that shouldn't be thrown like that. Likewise, if there is something that can be biodegradable, then that should not be thrown that way, giving rise to fleas and flies to roam around it. It should be properly closed and disposed of in a fashion that it is helping to degrade itself in the soil, not to be left out. We should also destroy disease causing insects or germs or pathogens if we find there is a scope or room for them to grow in a particular place. Fleas, mosquitoes, flies, all these things will carry the germs from the disease causing areas or the pathogens to our food, to our plate, to our hands, to our mouth. So this will cause us to fall ill. That is why we have to be careful about in which environment we are in. That is why normally we say you should not be eating on the streets, you should be eating in a home. How do you ensure cleanliness at home? Safe drinking water is necessary. We have to wash the grains or fruits or vegetables whatever before cooking. We have to cook thoroughly. We have to ensure not just steam it, cook it well. and keep the food covered. The vessels and plates should be washed well before and after use. What is personal hygiene? Washing your hands, brushing your teeth at least twice a day, flossing if necessary, ensure teeth and gums are healthy, regular bath you should have. Why? Because a lot of dust and dirt collected in the hair along with the oil of the follicle might cause problems in your hair. You should wash clean clothes, washed clothes, and then masticate means what? Chew and grind the food well. If you do this, then the particles staying on your teeth will be less. Two, it will be easily digestible. If it is easily digestible, it will be easily absorbed and not cause any disease. Or else what it will cause? It may cause indigestion, right? Then cough and sneeze. When you cough or sneeze, there is a room that or scope that or situation that you may be spreading some disease. Why? Because there are so many bacteria and microbes in your nose and mouth which will come out through the droplets and the secretions, and this, if somebody touches from their hands, it will go to their mouth and nose and they will become sick. So what we should do? We should use a napkin, we should close with our hands, we should wash our hands, we should wear a mask, we should take medicine if you are not well, we should not share the towels. These are the things that we do to ensure our sneeze or cough does not pass on the secretion droplets carrying microorganism which might make another person sick, right? And then diseases like cold and flu are usually spread like this. They have made a study, and in somewhere in London subway they found out if one person sneezes and coughs in one metro station at the place where you show your tickets to enter the station, that is enough to give rise to scope for 10,000 persons to fall sick. That means what? So many persons are passing through that area. So whatever the droplets in the air, the secretions from your nose and mouth is spreading there, that so many persons might have touched or inhaled or taken it in their hands and mouth, and they might become sick. That is the scope. That is why we say when you are having cough or sneeze, you should be a little careful. Not only that, the cough or sneeze is usually found in person who may be having diseases like flu, influenza. And this disease is caused by what? Virus and bacteria. And what are the symptoms? It may even lead to diarrhea or fever or joint pain, etc. That is why people have to be careful in ensuring not only that you fall sick, but ensure if you are sick, you don't make others sick. There is another virus called dengue. This is caused by mosquitoes. Aedes aegypti is the name of the mosquito. It causes different types of dengue, right? Like this, there are other diseases also, yellow fever, and then you have a SARS, which is a severe respiratory deficiency syndrome. So many different diseases are caused by different viruses, which are again spread through the air when you cough or sneeze. What is a miracle machine? Our human body is a miracle machine. We cannot create a body exactly like our human body. We may be able to imitate, we may be able to replicate, we may be able to copy certain organs of ours, but we cannot replicate our human body. What do we mean? When our kidneys don't work properly, we have a mechanism to have artificially function like a kidney by sending in good blood and taking out the bad blood. When our heart is not working, we have a heart and lung machine, right? When our teeth goes off, we have a denture. Like that, we have tried to invent certain things scientifically which will reasonably work like parts of our body. But we cannot replace the whole body. The whole body, the organ system, the respiratory system, the digestive system, the circulatory system, the skeletal and muscular system, the excretory system, all these, the nervous system, all these work together in tandem, in synchronization, dynamically, on its own, automatically, with rest only during sleep, in such a fashion that when you give food like rice and wheat, it will take, and then by breathing, it will convert it into energy, metabolism, it will send it through all parts of the body through the blood cells, and it will work. So if this body, miracle machine, has to work properly, then we need two things. One is proper good nutritious food, two, proper rest, and three, we should not do anything which will disturb the balance in these organ systems. Disturb the balance means what? We get disease, we get ailments, we fall sick. By what? By preventing the systems from working normally by putting spades in the wheel. For example, vitamin C deficiency causes bleedings in the gum. The bacteria and the plague causes the tooth decay. These are some of the diseases in your mouth. So if your mouth has some disease, if the eyes are sorry, if your teeth is not okay, if your gums are not okay, if your tongue is not okay, what will happen? You will not be able to chew and grind food properly. You will not be able to taste the food properly. That means what? Your food intake will not be normal. That means what? You may not have a nourishment. You may not have a balanced diet. So you might fall sick. So health of the mouth is one of the most important things. Second, whatever we perceive in the whole world, most 80% of them is because of what we see. So is the food cooked enough or not? Food is clean or not? Food is tasty or not? Food is edible or not? All that we decide by looking at the food. It's not necessary one spoon you should have before you decide what you want to do, right? So we have to take care of our eyes. What will happen? Incomplete or malnourished food, or the food doesn't have enough vitamins and minerals, might lead to blindness or loss of vision. Once we have a blindness or loss of vision, our lifestyle will go for a toss. Human beings will not be able to work like any other human being. Color blindness is genetic. It is not coming from the food. Conjunctivitis is coming from viral diseases. It may be reasonably cured. But if vitamins and minerals loss of that and incomplete food and nourished food causes loss of sight or loss of vision or blindness, then we will have a problem. So that is the reason why we have to take care of every part of our body, every organ of our system, so that the miracle machine works well. What is disease? Disease means not at ease. Not at ease means what? Not normal. Not normal means what? Abnormal. Abnormality of what? State of physical or functional well-being of the body. Nothing will be wrong with your hand, but you may not be able to pick anything with it. Nothing will be wrong when I look at you, but your brain may not be working in a fashion that you should be. That is what your brain is not properly functional. What could be the reason? You did not have proper sleep, you did not have proper food, you did not have proper rest, you have been stressed or you are under pressure for hundreds of reasons. So that is a not having a functional well-being. Physical well-being is you are very tired, you are feeling drowsy, you are feeling hungry, your eyes are not able to keep open to see what I am saying. So that is physical well-being is not there. So disability or comfort or ailment can't be called as a disease. It could be because of microbial infection also. It could be because of not having proper food also. It could be because of not having a proper lifestyle. Not having proper lifestyle means what? Sedentary lifestyle. Not having exercises, eating only junk food, drinking lots of Pepsi instead of water, smoking a lot, drinking a lot. All these things can be considered as poor lifestyle. Then it could also be you are having a disease because some of the organs failed. Your respiratory system is not working well and your lungs is not collecting enough oxygen from the atmosphere. Your respiratory system is not working well and your lungs are not properly sending all the carbon dioxide out from the body. Something is retained in the body. Excretory system is not working well or the waste is not thrown out of the body. It is staying in your intestine only and so your stomach is not well. So your overall mood is not well. So your body and mind is not functioning well. It is possible. So these are the things which are abnormal, not normal or causing disease. What are communicable diseases that can be spread from one person to another? Mostly contaminated water or air or food passes on or the vectors. Vectors is what? Things that carry the disease. Can be flies, can be fleas, can be germs, worms, anything. Healthy person must be protected from contacting this illness from a unhealthy person. So what is one method? Safe social distance. That is why during COVID we said maintain safe distance. Using of mask, using of sanitizer and all was encouraged. Why? Because the disease COVID-19 might spread from one person to another. Now, what is vaccination? Vaccination is something, a chemical compound invented by man scientifically as a medicine to prevent you from getting the disease. That means what? To boost your immunity. You will have additional immunity to prevent the disease attacking you if you take the vaccine. That is a vaccination, immunization. Some communicable diseases are microbial. For example, tuberculosis. Tuberculosis is caused by Mycobacterium tuberculosis. So what does this do? It is called a TB also. What are the symptoms if you get a TB or tuberculosis? You may have fever, weight loss, chronic cough. You may spit blood when you are coughing. You may have trouble in breathing. Normally it affects lungs and respiratory system related things, right? Now, If you have prolonged contact with another person having a TB, then there are chances you will also get TB. Why? Because of the sharing of the materials with the patient. Because that person is having cough and spitting blood and trouble in breathing, when he coughs, he will send out the microbacterium tuberculosis inside him to you through the droplets from the mouth through the air to your nose or mouth. So we have to be careful. Prevention. BCG vaccination could prevent you from getting TB to a large extent. What is treatment? Directly observed therapy is what we do for a TB treatment. All said and done, first important thing is you have to ensure you are taking proper care of the patient to help them get cured, remedy. Second thing is you take enough precautions that you don't catch the disease from the person. This is what we should do in all cases of communicable diseases. First is treat the person. Second is you ensure you don't get the disease. Another type of disease is cholera. It comes from Vibrio cholerae. What does cholera do? Cholera causes you to vomit. It may give you diarrhea also. What it means? When something in the stomach is affected, the stomach will send the food out through the mouth, that is vomiting, or stomach will send the food out through the intestines and anus, that is diarrhea and dysentery. So this is what happens because your digestive system will get affected if you have a cholera infection. Why it is happening? It might happen through consumption of contaminated food or water. That is why stomach is affected, contaminated food or water. So if a person having cholera had vomited and if the place is not properly cleaned up and if you have been meddling with it, your hands and mouth can also come into contact with the Vibrio cholerae, right? Prevention is by washing hands before and after eating, washing the vessels well, washing the plates well, heating the food properly so that the virus dies, and then keeping the food covered. Drink only boiled water. These are the methods in which cholera can be prevented. There are times when most of the people in the village will get the cholera at the same time because it will spread from one person to another. What's the treatment? There is an oral and intravenous hydration. That means what? Because you have vomiting or diarrhea, rehydration is what done. Sometimes we do antibiotics. Mostly what we do is rehydration, bringing the water level back in the body to normalcy. Vaccination is available for cholera. What is typhoid? Typhoid comes from Salmonella typhi. Salmonella typhi gives you typhoid. It causes what? Anorexia, headache, rashes on the abdomen, dysentery, high fever, even 104-degree fever is there. 104-degree fever means what? 100 is your normal temperature, we can say. When it goes beyond 100, that means you are having a high fever. 104 is too much. This is degree Fahrenheit. Degree centigrade is what? 37.5 is the normal temperature of a human being. Contaminated food and water is what gives typhoid also. Possibly there is a white coating on the tongue, or ulcer in the intestine, or rashes on the skin, or enlargement of the liver and spleen, or all of this are the symptoms or effects of typhoid, Salmonella typhi attack. We should keep the environment clean. Drink only boiled water. Dispose sewage properly is what we can do to prevent. There is a vaccination for typhoid also. Medicine is mostly antibiotics. Antibiotics will do what? Antibiotics will go and kill the bacteria. It will help the body fight the bacteria. Then there are certain, what we have seen is microbial infection. Typhoid, cholera and all is microbial. This is hepatitis is viral infection. It is very dangerous and it is very fatal. It affects your kidney, etc. Hepatitis. There is a vaccination and treatment is, there is no treatment for hepatitis. What we do is only relieve the pain, relieve the symptom. So what is the symptom? Loss of appetite, vomiting, eyes have some problem, and then urine is in yellow color. These are the ways in which we find a person having hepatitis displaying the signs, right? It comes from contaminated water or sharing of the needles or blood transfusion, right? How do we keep ourselves safe from hepatitis? One is drinking only boiled water. Another is again keeping your hands, mouth, vessels, pot, plate, everything clean and wash them before and after eating. So what treatment we do is to prevent nausea, prevent itching, prevent pain. For that we do some medication for relieving symptoms. We cannot treat hepatitis itself. The body has to automatically treat itself. Another viral infection is chickenpox. It comes from varicella zoster. It is a contagious infection. It spreads from one person to another very fast. Rashes on the body is the main symptom. Fever, headaches, tiredness could also be there. Spreads through air. That is why we have to maintain social distance, safe distancing. Vaccination is the best way to prevent. There is a vaccine. So whenever a person is traveling from a well-developed country to a country where there is a potential for chickenpox, the country will say, please take cholera chickenpox vaccine before going to that place. Treatment is only antihistamine to relieve the itching. Right? Rabies is fear of water is the main, what do we say, characteristic displayed by a person who is affected by rabies. They will have fever, but only after 2 to 12 weeks of getting the rabies infection, they will display the symptoms. So finding out that a person is infected is very difficult. It is a very fatal disease. Why it is fatal? Because this comes from the virus present in the saliva of the dog or a cat, and then it enters the brain via the neurons. What actually it does? The virus replicates a muscle at the site of bite and then infects the nerve and then replicates the dorsal root ganglion of the nerves, and then it travels, virus travels up to spinal cord and then to brain, and from brain on the way return it spreads to eyes, kidneys, salivary glands, everywhere. This is the problem. So when it affects the salivary glands only, we come to know that this person is having a problem with the rabies. It takes 2 to 12 weeks. It's very dangerous. So what we can do, before it reaches all this level, we can give a vaccine and try to cure if we know there is a infection, rabies infection. How do we know? Immediately when you have a rabies attack, that is a dog bite or whatever, we have to immediately go to a medical help. It is very difficult to detect. It takes 2 to 12 weeks. That is why, though this is transmitted by the bite of infected dog, rabbit or monkey, we should immediately go and seek a medical help. There is a rabies vaccination available for this. Now let us look at non-communicable disease. That means what? It will not spread from one person to another. That means what? Mostly they are not caused by germs or bacteria or living organisms that infect the body. So what is causing this disease? Sometimes it could be wearing out of the body parts, eyes, ears, joints, the filament on the joints, the bones, all this will have problems. Likewise, heart attack is because of certain portions of the muscles of the heart has become old. Migraine headache, because certain portions of the brain, the cells there feel they cannot anymore function normally. Cataract is a layer that comes in the between the eyes so that we are not able to see properly. So these are wearing out of the cells or tissues of the body. Then is external agents entering. What is external agent entering? You get allergy. When somebody smokes, you cough. When you smoke, nicotine goes inside you. When you drink a lot, your liver is affected. Maybe some poisonous thing came by mosquito bite or a snake bite, something like that. When you live in places where water is polluted, when you live in places where air is polluted and your breathing is not pure air, when you live in places the whole soil is polluted and so the food produced in that soil is polluted, you may have harmful agents entering you. They are not communicable diseases, but they will spoil the health of your organ systems. Then lack of trace elements. That means what? Deficiency in the diet or malnutrition. That means there are certain things which we need in small quantities in our body. If that is not there, it will cause diseases. For example, night blindness is caused by certain deficiency. Goiter or thyroid is caused by certain deficiency. Anemia in the blood is caused by certain deficiency. So these are lack of certain elements. This sometimes we will be able to remedy by having vitamin tablets, right? Malnutrition. Malnutrition is what? You are not able to grow well, you are not able to work hard, you are not able to stay healthy because, or you are not able to reproduce because your food that you have been having all these years does not have enough of the various nutrients that is required for it to be called a balanced diet to provide you a healthy lifestyle. In that case, it's a malnutrition. In so many places, in so many poor countries, in so many poor communities or societies, we have a problem called malnourishment, where because people are poor or people are illiterate or because of the scarcity of the material, not every child gets every necessary component of the food. Because of that, minerals or vitamins or proteins or vitamins or carbohydrates, something or the other is missing in the food, and that for a long time prolonged, when your food doesn't contain certain things, your health will become not suitable for normal life. It will have some disease, some ailment. some discomfort. Some diseases are genetic. For example, Leukoderma. Leukoderma is a white patches on the skin. Why it is white patches? Because the skin patches are lost. What is that? Melanin pigment is absent on the skin. Why this happens? There is no reason. This is genetic and this will not spread from one person to another. And unfortunately, there is no cure for this. So it will not affect anybody. You cannot get yourself rid of it and it is genetic and it is non-communicable. So these are about non-communicable diseases. Then there are certain problems which children face normally. What is that? Anemia. What is anemia? Eating food with less of iron. So absence of enough iron in the body causes anemia. How do we know? It will give a hookworm infection or it may give diarrhea and dysentery in children. What are the symptoms? These are the disease causes. The disease causes these problems. Symptoms are pale or transparent skin, pale eyelid, pale fingernails, pale gums. That means what? Your lips, your eyes, your fingers, whatever is normally reddish is not so because of anemia. Your face and feet may be swollen. Your heartbeat may be rapid. You may have breathing trouble. That is in the advanced stage. So what are the preventive measures? You can have moringa leaves. What is this drumstick? You can eat dates. You can eat liver of the sheep or chicken. That is why in certain places you will find people will buy mostly liver, thinking this will help them to cure anemia. Green and leafy vegetable, which is easily and normally possible on everyday meal, is one thing that is very helpful. Peas, beans, lentils also will help to prevent anemia. There is also medicine, cod liver tablet or other fish oil tablets will help to fight the anemia. Right? What are the safety and first aids? First aid is something that is done first when somebody is the moment somebody suddenly becomes ill. First aid is not done for you getting a fever over a period of time. First aid is done when suddenly you fall down or suddenly you faint or suddenly something happens to you. So immediate treatment given before professional medical help can be given to you. It is done to save life. It is done to prevent further bleeding or further damage to the bones broken or the joints broken. It is done to decide on what further course of action. Are you able to move your hand left and right? Is it okay to wait for the ambulance or should we take you to the hospital type of thing? First aid is also done to relieve pain. So first aid is done to ensure the person who contacted the disease or contacted the or met with the accident or suffered a sudden disease, maybe heart attack or maybe something else that makes you immediately lose control over your body to ensure that you reach a medical facility safe. That is what is called a first aid, the aid that is given first before the professional help comes. It could be a artificial respiration to help you breathe. It could be when you break down and break your leg to make you sit or stand on a place. It could be when you get an electrical shock or a fire to ensure that you don't lose much more of your capability of your body to function till the medical help comes. It could be many ways. So in case of a burns, what do we do? There are actually three type of burns. So first degree means only the epidermis, outer portion of the skin is burnt. Second degree means epidermis and the dermis, the lower layer of the skin is burnt. Third degree means still below, not only the skin but the tissue and the muscle below also got damaged. So depending upon that, the treatment will be different. Normally this burn is caused by maybe heat or chemical or even sunlight or nuclear radiation. So building fire or kitchen fire also might cause this liquid or solid that will cause little lesser problem. When it is gaseous, it will cause more problem. If it is a very serious third degree burn, we may have to use skin grafting. Take a skin from one place and paste it on the place where the skin has burnt out to help it cure. Right? What is the first aid? Wash with cold water. Antiseptic cream or liquid is applied, provided it is first or second degree. If it is a third degree where tissue is damaged or if blisters appear, then please do not wash with water. Just cover it with a non-sticking cloth. Why non-sticking cloth? The tissue is already burnt. If you put a sticking cloth, it will stick to the tissue. So use a non-sticking cloth and then seek immediate medical help. Always keep a fire extinguisher. Always be safe when you are working with fire. These are the preventive measures. Cuts and scratches also happen. Cut means what? A line on the skin, right? What is scratch? Only the surface of the skin has got damage. It has not penetrated below. Cut means what? the skin has been cut, the tissue below has been cut, maybe nerves are also cut, and maybe blood is coming out. So what it will do, it might bleed, it might turn red, and it may infect, that is other disease causing germs on the atmosphere can sit there and cause further problem. It may leave scars. These are the problem with cut and scratches. It should be ideally be washed with running water so that no dirt or dust is there. It should be cleaned with an antiseptic liquid, and then some bandage or gauze should be put so that no foreign body sits on it. Whenever you are giving first aid, you should try to wear gloves or a plastic bag on your hands. You should try to wash your hands before and after helping that person. You should use soap to clean yourself. You should ensure you do not come into contact with the patient's body fluids. Why? To prevent some unexpected damage to your health by trying to help the other person. We should be careful not to prick yourself with the needles or the knife or whatever when you are trying to help the other person. You should be careful you don't get burnt when you are trying to pull the other person out of the fire. So we have to be, the person giving first aid should be as careful or more to ensure he doesn't get into damage while trying to help the other person. Why? If you also lose your capability to help, then both of you will suffer. You will not be able to save the other person. Now one tidbit is that penicillin was the world's first antibiotic. Penicillin. It was discovered by Alexander Fleming somewhere in 1928. It was an accidental discovery and it helps in curing pneumonia, diphtheria, etc. So penicillin was an accidental discovery. It was discovered sometime in 28 and it is the first antibiotic. It is called the mother of all antibiotics for that reason. Right? Thanks for watching this video. Please keep coming back for more such sessions on science.